emerging and high demand nursing specialties, and also will be recognizing what would be the global employer expect from nurses nowadays, and also to understand the importance of academically progressed and to become a proper, well-trained, uh, you know, uh, qualified nursing professional in the future to address 2026 requirements and the demands in nursing. So, we'll talk about the modern nursing. Before that, you already know the nursing is a profession where we provide primary care to the patient holistically. We approach holistically to the patients. Not only we assess, not only we diagnose, not only we treat along with the doctors, not only we evaluate, not only we rehabilitate the patients, we do everything in a holistic manner. So nurses are not just professionals, they are sometimes counselors, they are sometimes a very nice friends to the patient, they are sometimes a very compassionate person to the patient, maybe probably the one last compassionate or the close loving person that one patient can meet in their at the end of their lifetimes. It depends on how we act and treat in the field of nursing. So basically, nursing is a profession which always based on the compassion. So without the compassion, you never can become a nurse. So as we all know, basically the nurse who we identified as a conventional nurse, they were actually stayed and worked in a hospital. So today we'll be talking about something beyond the hospital walls. So what is the new trends in nursing? So when we are talking about the modern nursing, uh, uh, as I mentioned, nursing is no longer limited to a bedside care. So nurses works in in education, research, leadership, technology, policy, development, and many more. So global health challenges demand multi-skilled nursing professionals. So in case if you need, further support on this, මම අර කලින් කිව්වා වගේ නර්සින් කියලා කියන්නේ ගොඩක් වෙලාට අපි ලංකාවේ අපේ ක්ලෝස් සොසයිටි එක හිතාගෙන ඉන්න දෙයක් තමයි නර්සින් කියලා කියන්නේ we are just supporting to the medical staff or we are just doing patient care we are just giving drug අපි drugs දෙනවා අපි injection විදිනවා අපි ලෙඩ්ඩු බලා ගන්නවා නැත්නම් අපි ඒ තියෙන රූටින් වැඩ ටික කරන එක තමයි නර්සින් කියලා ගොඩක් වෙලාට අපි හිතාගෙන ඉන්නේ. නමුත් මොඩර්න් නර්සින් කියලා කියන්නේ මීට වඩා ගොඩක් එහාට ගියපු ගොඩක් බ්‍රෝඩ ස්කෝප් එක කතා කරන ටොපික් එකක්. ඉතින් අලුත්ෙන් අපි ගත්තහම මේ නවල් නර්සින් ෆීල්ඩ් එක ගත්තහම ඒක not only for the primary care වලට විතරක් නෙවෙයි ඊට අමතරව educational aspect එකට research aspect එකට leaderships වලට නායකත්වයට ඊළඟට especially with technology and policy developments වලට වෙනකම්ම නර්සින් කියන ෆීල්ඩ් එක මේ වෙනකොට spread වෙලා ඉවරයි. ඉතින් අපි ගත්තොත් if we discuss about the global demands to the nursing, so according to the 2026 outlook, so we identified there is a worldwide shortage of qualified nursing professionals, right? So 2026 we have identified a huge shortage of qualified nurses all around the world. So mainly we identified aging population increasing chronic disease burden. So ඒක හරිම common norm එකක් මුළු ලෝකෙම තියෙන මේ වෙනකොට yes මේ වෙනකොට අපි දන්නවා මේ ලෝකෙම තියෙන මානව ජනගහනය මේ වෙනකොට වයසට යමින් පවතිනවා, right? So with this aging population, there is an increased demand of disease burden, especially non-communicable diseases. Non-communicable diseases means the disease conditions which are not communicated or spreads through person to person, but some diseases, for example, like hypertension, diabetes mellitus, Maybe some people might take, cholesterol or maybe hyperlipidemia. There are different disease conditions which we identified as non-communicable diseases, including dementia, stroke, something like that. So, apart from that, the worldwide shortage can cause a migration and global mobility of nurses rising. So, the next thing is strong demand in UK, Australia, Canada, Middle East and Europe. So ලෝකේ නර්සින් ෂෝටේජ් එකක් ඇති වෙන ප්‍රධානම හේතු ටිකක් තමයි ලෝකේ දියුණු රටවල් වලට ලොකු ඩිමාන්ඩ් එකක් තියෙනවා නර්සින් ප්‍රොෆෙෂන් එකට. ඒක නිසා ගොඩක් වෙලාවට අපේ වගේ රටවල් වල ඉන්න නර්සින් ස්ටාෆ් නැත්නම් නර්සින් ප්‍රොෆෙෂනල්ස්ලා කරන්නේ මේ වගේ දියුණු රටවල් වල තියෙන දියුණු ඔපචුනිටිස් වලට ඒකොල්ලෝ මොබිලයිස් වෙන එක. එහෙම නැත්නම් ඒකොල්ලෝ ගමන් කරන එක. මේක නිසාත් ලෝකයේ විවිධ රටවල් වල මේ වෙනකොට nursing shortage එකක් හැදිලා ඉවරයි. Especially in Asian countries, African countries, and some of the Schengen countries that we have identified. So, apart from that, global nursing shortage now has become a critical challenge, right? So, we identified, according to WHO, worldwide nurses shortage in 2026 is usually, approximately around 5.8 millions of nurses. So we have a 5.8 millions of nurses shortage all around the globe currently, which, they forecast that this particular thing will persist, or this particular shortage will persist around 2030, until 2030. So workforce growth is unevenly distributed, as I told you, because of the opportunities based on your qualifications might be vary from country to country. So most of the people or most of the nursing professionals might be, leaving to another developed country with developed opportunities, or with better opportunities and offers. So as I told you, with this shortage has, demographically spreaded, and it is not equally spreaded. Therefore, we identified 78% of nurses serves only 49% of the world population. සරලවම කිව්වොත් අපිට මුළු ලෝකෙම ඉන්න නර්සින් ප්‍රොෆෙෂන් එකේ 178ක් ඇත්තට මේගොල්ලන්ගේ සර්විස් එක දෙන්නේ මුළු ලෝකෙම 150කටත් වඩා අඩු ප්‍රතිශතයක ජනගහන ප්‍රමාණයකට විතරයි. එතකොට ඉතිරි 122 තමයි ඉතිරි 151ක් ජනගහනයට සර්විස් එක දෙන්න ඉන්නේ. එතකොට ඔයගොල්ලන්ට දල අවබෝධයක් ගන්න පුළුවන් කොයිතරම් ලොකු ක්‍රිටිකල් චැලෙන්ජ් එකක් and කොයිතරම් ලොකු නර්සින් ෂෝටේජ් එකක් ලෝකයේ තියෙනවද කියලා. So one of the best example is the COVID-19 pandemic. Even a developed country couldn't stand for it because of this particular resource limitation. Medical staff, nursing, or the skilled healthcare workforce staff shortages caused a lot of, deaths, or a lot of, sort of a huge calamity. So impact of shortages. So it impacts because of this particular shortages, it has this increased workload and burnouts, and reduced quality of patient care, and strong international recruitment from developing countries. So this is the main thing that I want to highlight. So because of this shortage, most of the time, the nurses have to face several issues, mainly the workload. So usually, now if you take Sri Lankan context, at least one nurse has to, there might be a nurse to patient ratio, maybe 1 to 60, around 1 to 40, depends on the demographic area. But so based on that, we can identify there's a huge workload for the nursing staff nowadays in all around the globe. And based on this, so if you have a lot of workload, ultimately what would happen to you is you will get burnout. So reduce quality of patient care. So based on this huge workload, you might probably not be able to provide 100% quality care or 100% holistic care to the patient. And the other thing is, while you are, being burnout and you are having a lot of workload, this would gives you another thing. So if you are a nurse, then nurses, what they do is they are trying to go for a better offer, so better opportunities. So most of the time, the developed countries hire you for better salaries and better opportunities and better offers. So then, still, your shortage might get increased. Even in Sri Lanka, this might be a huge issue nowadays that we are facing. So if I, මම එක තවත් සරල කරලා පැහැදිලි කළොත් ඇත්තටම නර්සින් ස්ටාෆ් එක ලංකාවේ ගත්තොත් ලංකාවේ අපිට ගවර්න්මන්ට් සෙක්ටර් එක තියෙනවා ප්‍රයිවට් සෙක්ටර් එක තියෙනවා නේ. එතකොට even in government and private sector you might have seen we don't have enough staff, especially the nursing staff, because nursing people or the nurses එයාලා තමයි අපි කියන්නේ primary caregivers ලා. patient හම්බෙන පළවෙනිම care provider තමයි nurse. එතකොට එයාට දෙන workload එක වැඩි වුණාම වෙන්නේ especially the professional get burned out. එයා burn out වෙන එයාට මේ task එක කරගන්න බැරි වෙනවා. Ultimately what happened is it will reduce the quality of service that they provide. උදාහරණයකට අපි හිතුවොත් patient කෙනෙක් pain එකේ ඉන්නවා. ඒ patient there might be a patient who is in pain and that patient might be having a wound, right? And you need to provide wound care. අපිට wound එකට බෙහෙත් දාන්න වෙනවා and still the patient is in pain. So අපි nursing කරද්දී අපි හැමතිස්සෙම කතා කරන දෙයක් තමයි nurses has to be approach to the patient holistically as possible, as holistically as possible. That means අපි nurse කෙනෙක් විදිහට එයාට approach කරන්න පුළුවන් හැම පැත්තෙම අපි approach කරන්න. එයාගේ social aspect එකට patient ගේ approach කරන්න ඕනේ. We have to approach the psychological aspect of the patient and we have to approach the clinical aspect of the patient. But with the huge workload, probably nurses might not be able to do that. So ultimately what happens is they might reduce the quality, they might probably do that wound dressing and they might leave. So nobody is there to consider about the patient's psychological aspect or the family's issues or maybe the social aspect of the patient. So ultimately what happens is your care provision quality would be reduced. So this is the main challenge that you face due to a huge nursing shortage. So what this means to the new nursing trends or 2026 nurses or beyond. So here you can identify there is a huge opportunities for nursing students or nursing professionals all around the globe to improve the strong global employability for qualified nurses. So growing demand for nurses with degrees, postgraduate qualifications, specialty certifications, research and leadership skills. As I told you, nursing is no longer a position or a profession where you have to work with the bedside care and do all these bedside care. So that is not nursing nowadays. Nursing is a emerging and we have spreaded our wings into a very broader perspective now so that your demand will be more and more gets more and more higher if you have a degree or if you have a postgraduate qualification in nursing, if you have any specialty certification, and if you have research and leadership skills. So we'll talk about those things in in the other slides as well. So what is the strategic advantage in case if you are expecting to become a nurse or if you are already a nurse and you want to improve yourself or master your qualifications? So countries like Sri Lanka are the key contributors to the global nursing workforce. I will tell you why a little later, but just to take you on on that note, especially the Sri Lankan nursing professionals are well recognized all around the globe. We'll tell you why a little later. So as I told you, if you have a higher educational qualifications and with continuous professional development, you have acquired all these skills, your global mobility is very high. So that means you will be definitely getting more and more opportunities and more offers. So you will improve your profession as well as yourself. So ලංකාවේ ගත්තාම ලංකාවේ ගොඩක් nursing professionals ලට තියෙන වැදගත්ම part එක තමයි ඒගොල්ලන් ගොඩක් well recognized all around the globe. එකට හේතුව තමයි their skills and their knowledge. So මේක ඇඩ්වාන්ස් කරන තරමට ඕගොල්ලන්ට තියෙන වාසිය තමයි ඕගොල්ලන්ගේ global employability opportunities open කරගන්න පුළුවන්. Right? So why nurses are the backbone of healthcare? So, as I told you, nurses are the backbone of healthcare. We consider nurses are the backbone of healthcare. So, if you get the healthcare sector, the majority of the healthcare population is comprised of nursing professionals. So that is why it calls the backbone of healthcare, because they are the people who would be first to meet the patient, not the doctor, not any other healthcare professional, but the nursing staff. They are the one who is welcoming the patient. They are the one who is doing initial assessment of the patient. They are the one who is doing, all this preparation. They are the one who is guiding all the patients to the particular medical care, medical treatments. So there are different aspects. So that is why we consider nurses are the backbone of healthcare. So largest workforce in healthcare globally is considered the nurse. So they play, as I told you, they play a critical role in patient safety and quality care. So they are the people who responsible to provide the quality care. So in terms of care, we can't talk care without nurses in the field of healthcare. So key contributors to the universal health coverage. So they are the key people who, universally consider the maintaining the quality of the health services and leadership roles in multidisciplinary healthcare teams. So multidisciplinary healthcare teams means the healthcare team members. So if you are admitted to a hospital, you might have seen not only the nurses. So this particular team who treat or giving the service to you would be the doctors, special doctors, nurses, and other healthcare professionals, for example, like maybe pharmacists, medical laboratory technicians, medical laboratory scientists, physiotherapists, occupational
බස් එක
therapists,
ආවන්නේ එපා වුණා.
likewise.
ඕ අලුත් ගමන් අතර හිටිය ගාලා වරුවගේ නට ඉස්සරට හිටිය එපා වෙන මේ හවසට එන්න ගියන් පස්සේ යන්නේ. බස් අඩුයි. වරුවකට පස්සේ ගාලා ඒකත් මේ මගහරියක් කොට කොට ඇවිල්ලා ඉරිසේ අලුත්
I think someone's mic has turned on. I hope that it's settled. So we'll continue. Why nurses are the backbone of the healthcare? So ඒකයි මම කියන්නේ නර්සස්ලා කියලා කියන්නේ healthcare sector එකේ තියෙන හරියට කොඳුයට වේලිය වගේ. ඒකට හේතුව තමයි අපි ගත්තොත් health sector එකේ ඉන්න ලොකුම work population එක විදිහට අපිට consider කරන්න පුළුවන් nursing staff එක. අපි hospital එකක ගත්තත් ලොකුම population එකේ ඉන්න nursing staff එක compared to the other professions in the hospital. So එයාලා තමයි primary care providers. එහෙම නැත්නම් patients ලට initially care provision එක කරන patient ගේ head to toe care එක දෙන, එහෙම නැත්නම් අපි කියන අර holistic care එක සම්පූර්ණ care එක දෙන වෘත්තිකයා විදියට ක්‍රියා කරන්නේ nurse. So they have this particular leadership roles in multidisciplinary healthcare teams. So that means nurses are playing a special leadership roles in, the healthcare team in a hospital. So that is why we consider nurses are the backbone. So as I wanted to highlight here is how important the profession of nursing in the field of healthcare. So moving forward to discuss about the trending nursing specialties in 2026. As I told you, nursing is not just mere a profession, it is a very emerging, trending profession nowadays, and the demand is very high. And according to the 2026 nursing global trends, these are the trends that we identified. These are the nursing specialties that we identified which are having highest demand all around the world, and highest paid nurses would be the nurses who are having certain specialties on the following fields, right? So first one is critical care and emergency nursing, right? So it is not just nursing, it is critical care. So in case of especially maybe some people might identify them as, ICU nurses or emergency nursing, or maybe the people who are mainly work in the accident service units or maybe emergency treatment units. So they have certain skills mainly to critically apply your knowledge and fast moving actions. They have very well experience and skills. They need to be very fast and to take decisions in a very short period of time. And with a lot of experience and expertise, critical care and emergency care nursing is one of the highest demanding nursing trend in 2026. The next most important other thing is the mental health and psychiatric nursing. Nowadays, we know most of the world population is having a lot of troubles, so they are struggling with psychological issues. It could be anxiety, it could be depression, it could be other types of disease condition, and we have seen that prevalence of dementia and related Alzheimer's disease. There are prevalence of all these kind of disease which directly causes the cognition of the patients has been increased. So mental health and psychiatric nursing is one of the most demanding nursing specialty in 2026. And the other thing is geriatric elderly care nursing. As I told you, geriatric and elderly care means mainly the people who will be, the nursing, special nursing care that is provided to the patients who are, uh, older than 60 years of age. So we take them under the geriatric category. Geriatric means elderly people. So elderly care nursing is one of the most demanding nursing specialties, especially in developed countries. As I told you, uh, elderly populations all around the world has been, increased, especially in developed countries. They have to face, it has become a burden to the developed countries nowadays. Therefore, this particular care provision to these elderly people is a mandatory component that they have to face, and they have to pay attention to. So therefore, most of the developed countries has identified the trend of geriatric nursing or elderly care nursing is very high. This particular nursing specialty is highly demanded and highly paid in developed countries. The next thing is community and public health nursing, right? So community and public health nursing is somewhat new to our Sri Lankan context, as I told you. So it was established in Sri Lanka, but still not 100% properly worked out. However, community and public health nursing is also one of the most trending nursing specialty in 2026. And the palliative and end of life care. So palliative and end of life care comes under mainly with, the chronic disease conditions, right? Maybe the cancer care. So likewise, these are, also consider as another highly demanding nursing trending all around the globe. So අපි ගත්තහම මේන්ලිම නර්සින් ස්පෙෂාලිටිස් ගැන අපිට කතා කරනකොට ඇස්පෙක්ට්ස් කීපයකින් කතා කරන්න පුළුවන්. දැන් මෙතන මම මේ මේන්ලි highlight කරලා තියෙන්නේ දැනට ලෝකයේ තියෙන highest trending, highest demanding nursing specialties ටික. එතකොට එතනදී අපි මේන්ලිම කතා කරන මේ critical care and emergency care කියන එක. නැත්නම් emergency care, critical care නැත්නම් අපි සාමාන්‍ය ව්‍යවහාරයේ කතා කරන්නේ ICU nurse. එහෙම නැත්නම් ETU nurse කියලා. එතකොට මේක highly trending specialty එකක් දැන් වෙනකොට ලෝකේ. ඒ වගේම තමයි mental health and psychiatric. එහෙම නැත්නම් අපි කියන්නේ මනෝවෛද්‍ය විද්‍යාව හෝ එහෙම නැත්නම් මානසික රෝග සම්බන්ධයෙන් ප්‍රතිකාර කරන එහෙම නැත්නම් ඒ සම්බන්ධයෙන් කටයුතු කරන නර්සින් ප්‍රොෆෙෂනල්ස්ලා ඉන්නවා. ඒ වටම ස්පෙෂලායිස් වෙච්ච නර්සින් ප්‍රොෆෙෂනල්ස්ලා ඉන්නවා. ඒගොල්ලෝ අනිත් ට්‍රෙන්ඩින් ප්‍රොෆෙෂන් එක. ගොඩක් වෙලාවට ඔයගොල්ලෝ දැකලා ඇති, ඔයගොල්ලන්ට ස්ටඩි කරලා තියෙනවනේ. ඔයගොල්ලෝ දැකලා ඇති ගොඩක් වෙලාවට මේ ඩෙවලොප්ඩ් කන්ට්‍රීස් වල තියෙනවා ඩිමෙන්ෂියා සෙන්ටර්ස්. දැන් ලංකාවෙත් අපිට ඒ වගේ සෙන්ටර්ස් කීපයක් දකින්න පුළුවන්. ඩිමෙන්ෂියා සෙන්ටර්ස් ඒ වගේ ගොඩක් වෙලාට මේ mental issues වලට විතරක් focus වෙච්ච centers තියෙනවා. So people or the nursing staff who are specialized to these particular areas would be working in these centers. So මේකත් ලෝකේ දැනට highestම trending අතර තියෙන clinical skill එකක් clinical specialty එකක් in nursing. And community and public health nursing is, as I told you, another one. So මේකෙදි mainlyම ඔයගොල්ලන්ට බලන්න පුළුවන් දැන් ඕස්ට්‍රේලියාව වගේ රටවල් වල මේ community and public health nursing කියන එක well established රටක් තමයි ඕස්ට්‍රේලියාව කියලා කියන්නේ. ඒගොල්ලන්ට ගොඩක් වෙලාට ඒගොල්ලෝ ටෙක්නොලොජි එකත් එක්ක මේ community health nursing කියන part එක well played. So මේ specialty එකත් very well trending in 2026 because most of the hospital setups need to, you know, manage their resources and reduce, readmissions of the patients or recurrent admissions of the patients so that certain conditions can be taken care in the community setup. For example, stroke. අපි stroke condition එක වගේ දෙයක් ගත්තොත් අපි දන්නවා post stroke episode එක ලොකු දීර්ඝ කාලයක් යන episode එකක් අපිට patient කෙනෙක් hospital එකක නවත්තගෙන කරන්න බැරි දෙයක්. එතකොට ඒ වගේ වෙලාවකට community nurse ලොකු රෝල් එකක් ප්ලේ කරන්න තියෙනවා. පබ්ලික් හෙල්ත් නර්ස්ට ලොකු රෝල් එකක් ප්ලේ කරන්න තියෙනවා. then ඊට අමතරව අර මම කතා කරපු non communicable diseases hypertension වෙන්න පුළුවන්, නැත්නම් ওই blood pressure කියන එක, එහෙම නැත්නම් දියවැඩියාව, එහෙම නැත්නම් high cholesterol levels, එහෙම නැත්නම් dementia, stroke or any kind of non-communicable diseases can be very well managed in the community setup. So that is again a very very well specialized, very highly demanding specialty in nursing all around the world. And the palliative and end of life care. ඔයගොල්ලන්ට palliative and end of life care ගැන කතා කරද්දී ඔයගොල්ලන්ට මතක ඇති ගොඩක් වෙලාවට ගොඩක් developed countries වල COVID pandemic එක කාලෙදි මේක ගොඩාක් experience කරන්න හම්බුණා nursing staffs වලට. So ඒ කාලේ තමයි අතර මේ trend එක සහ මේ specialty එක ගොඩක්ම highlight උනේ end of life care and palliative care in nursing. So as I told you, most of the developed countries are highly concerned about these specialties, right? So when you are developing your career, when you are having a focus to improve your career goals, you can consider all these particular trendings. එහෙම නැත්නම් කුල කවුරු හරි හිතාගෙන ඉන්නවනම් මේ නර්සින් ෆීල්ඩ් එකට එන්න, මේ නර්සින් ෆීල්ඩ් එකේ මෙන්න මේ වගේ ස්පෙෂල් ෆීල්ඩ්ස් වලට ඔයගොල්ලෝ ඇඩ්‍රස් කරන තරමට ඕගොල්ලන්ගේ ප්‍රොෆෙෂනල් වැලියු එක වැඩි වෙනවා. Right. So not only that, not only the clinical aspects, there are certain other things. Nowadays we know, the whole world is, always connected. So the technology-driven nursing roles are very important nowadays because we cannot go without the technology. Nowadays, technology has invaded every single, the profession, every single fields. So, we cannot get over from it. So, of course, technology-driven nursing roles are very highly demanding nursing roles nowadays in all around the world, especially under the nursing informatics. So if we talk about the telehealth and virtual care settings or virtual care nursing, I will discuss. This is a very interesting part. So if someone is interested about this particular telehealth and virtual care nursing, I will discuss one by one. And digital health coordinators and AI-assisted clinical decision support roles. Unfortunately, still these things are not very much functioning in Sri Lanka, but of course, that certain other developed countries, yes. So health data and quality analysis. So mainly, the nursing professions under this nursing informatics, telehealth and virtual care nursing is a very well established nursing specialty in most of the developed countries, especially in Australia and other countries as well. So telehealth means what? Telehealth means using digital medias, digital equipments. Nursing professionals provide certain care, advices, health education, follow-up care, and all these treatments can be done in a in a distance patient. For example, there might be a certain center in a certain setup, and that particular center can provide care, follow up the patient, do all these diagnostics, and give the health education and follow up the patient who are living in thousands and thousands miles away. So technology is now available to provide all this care as required. So Australia is, as I told you, Australia is the country which we identified as the highly established rehabilitation system in all around the world. So what they do is they do this particular telehealth and virtual care nursing. So there might be certain things that we can do, not every single thing when it comes to the primary care, but we can do certain things using this virtual nursing care category or telehealth category. So that is uh, one thing. And digital health coordinators. So that means the people nowadays you might have seen there are certain handheld applications, softwares, websites available which can give you health education, which can guide you to do certain things, which can teach you and follow up with you to maintain your certain disease conditions or to maintain your diets, maintain your physical activities, things like that. So this will be coordinated by the nursing staff, nursing professionals who are having specialty on this particular area. So these are novel global trends. So if someone is interested, these are the most highly demanding uh, technology-driven nursing roles and AI-assisted clinical decision support roles. Now, this is one of the most important or most trending nursing role nowadays, but still in Sri Lanka, of course, we still are not ready to get these type of roles in Sri Lankan setup. But however, these things are available all around the world. AI has invaded the every single part of the world. So every single part of the world. Therefore, um, uh, we can't actually refuse artificial intelligence, right? So, in simple terms, artificial intelligence or AI already invaded the healthcare sector as well. So sometimes AI nowadays we use for diagnostic purposes and other, the follow-up care purposes and health education purposes. So yes, there are certain specialties in nursing roles, with this AI assisted clinical decisions and health data and quality analysis. So that means mainly related to the quality assurance of the health services and health data analyst who is, mainly deal with certain conditions in the community setup or the population based setup. So අපි මේක ගත්තොත් මේ ටෙක්නොලොජි එකත් එක්ක යන මේ නර්සින් අපිට නිකන් මේ අමතක කරන්න පුළුවන් එකක් නෙමෙයි දැන් වෙනකොට ලෝකේ ලොකුම ට්‍රෙන්ඩ් එකක් වෙලා තියෙනවා මේ ටෙක්නොලොජි. ඒකට ටෙක්නොලොජි කියලා කිව්වහම ස්පෙෂලි ඩිජිටල් ටෙක්නොලොජි, so digital technology related applications, robotics මේ වගේ ගොඩක් දේවල් ලෝකයේ ගොඩක් රටවල් වල තියෙනවා. එතකොට ලංකාවේ තාම මේවා අපිට කියන්න බෑ 100%ක් එස්ටැබ්ලිෂ් වෙලා තියෙනවා කියලා. but of course yes ලෝකේ ගොඩක් රටවල් වල මේක බොහොම දියුණු විදිහට ව්‍යාප්ත වෙලා තියෙනවා මේ වෙනකොට. එතකොට මේකත් එක්ක 2026 වල අපිට ඇතිවෙච්ච ගොඩක් important nursing specialty roles කීපයක් තමයි මම මේ කිව්වේ. telehealth and virtual care nursing. එහෙම නැත්නම් අර අපි මම කියපු විදිහට අර digital medias, digital equipments පාවිච්චි කරලා patients ලට care කරන්න, patients ලට educate කරන්න, එයාලගේ diagnostics වලට, එයාලගේ assessments වලට patient assess කරන්න. එතනින් ගියාම ඒගොල්ලන්ගේ follow up care, health education provision මේ හැමදේම කරන්න පුළුවන් methods මේ වෙනකොට available. ඒවට specialized nursing staff ඉන්නවා මේ ලෝකේ. ඒ වගේම digital health coordinators. එතනින් ගියාම මට ඊළඟට මේ කියන්න ඕන අනිත් දේ තමයි AI assisted clinical decision support roles. මේක ලෝකෙ දැනට ගොඩක් trending, ගොඩක් දියුණු රටවල් වල මේ AI assisted clinical decision support roles අපි follow කරනවා. Especially AI might not be able to diagnose each and everything in a 100% proper way. AI might not be able to assess, might not be able to give you 100% proper health education. So to moderate and to give certain things and to take it under control, there might be certain nursing specialties or nursing roles available. So that is it. So these are the main trendings that we identified mainly under technology-driven nursing roles. So what global employers looking for nowadays in nursing? නර්සින් ෆීල්ඩ් එකේ ග්ලෝබල් එම්ප්ලොයර්ස්ලා ග්ලෝබලි ලෝකේ ඉන්න ගොඩක් හයි ඩිමාන්ඩින් එම්ප්ලොයර්ස්ලා මොනවද නර්සින් ෆීල්ඩ් එකේ මේ වෙනකොට හොයන්න කියලා දැනගන්න එක ස්පෙෂලි නර්සින් ඉස්සරහට ඉගෙන ගන්න කැමති නර්සින් වලට කැමති එහෙම නැත්නම් මේ වෙනකොටත් නර්සින් කරන ඔයාලගේ ප්‍රොෆෙෂන් එක ඉම්ප්‍රූව් කරගන්න බලාපොරොත්තු වෙන කට්ටියට ගොඩක් වැදගත්. So mainly ඒගොල්ලෝ බලන දේවල් කීපයක් තියෙනවා. The first thing is strong clinical competence, right? So global employers, they what they look for, so mainly they are looking for your clinical competence. So your skill and knowledge must be the first thing that you need to acquire 100% clear and concise manner. So evidence-based practice and knowledge, mainly your research related knowledge, evidence-based practice knowledge. So that means you are always improving your practice based on the novel available evidences, novel available scientific data, novel available scientific guidelines. So that is one thing. So communication and leadership skills. Of course, nurses are not just person who is doing passively care into a patient. So they are they have to be a very well communicator, then they have to be a very well leader, have to have a very good leadership skills, especially when it comes to the patient care, because without proper communication we might not be able to you know uh, do this particular task in terms of providing care to the patients, because we need support from the doctors, we need support from the other healthcare professionals. So that communication is most important thing. So most of the time nurses might be the first person who is identifying, who is assessing, who is notifying certain things, certain requirements of patients. So communication is one of the most important things. It might be a written in communication, might be a verbal communication. The next thing is the leadership skills. The third thing that we need to consider is cultural competence and adaptability. So, in Sri Lankan cultural context, you might be having a proper, certain idea about, if you get into a government hospital, how the nursing staff is working on. So, if you get into a private hospital, how this nursing staff is working on. So, there might be, the particular cultural competencies and the cultural differences can be identified. So, if this particular nursing professionals goes into another country, so how you adapt. So your adaptability is again another important things that your employers are looking at. So the next thing is digital literacy and research awareness. This is one of the most important things, especially when you are going to a developed country, when you are going to another, moving to another country to do the nursing profession or, practice nursing. Your digital literacy must be, acquired, and your research awareness. Without the knowledge of research, you might not be able to, move forward. So අපි ගත්තාම ලෝකේ මේ ග්ලෝබල් එම්ප්ලොයර්ස්ලා මේ ලෝකේ නර්සින් ප්‍රොෆෙෂන් එකට තියෙන මේ ඩිමාන්ඩ් එක ගැන හොයන මේගොල්ලන්ව හයර් කරන මිනිස්සු ගොඩක්ම මෙන්න මේ කාරණා ටික තමයි මේන්ලිම බලන්නේ. ඔයගොල්ලන්ට හොඳටම ක්ලිනිකල් කොම්පිටන්ස් එක තියෙනවද? ඔයාලට ක්ලිනිකල් ස්කිල් එක හොඳටම තියෙන නර්ස් කෙනෙක්ද කියන එක ඒගොල්ලෝ මේන්ලි බලනවා. එවිඩන්ස් බේස්ඩ් ප්‍රැක්ටිස් නොලෙජ් කියලා කියන්නේ අපි අවුරුදු 20කට කලින් කරපු ප්‍රැක්ටිස් එකම නම් අදත් කරන්නේ. That is not the right thing, probably not be the right thing. අපි අවුරුදු 20කට කලින් කරපු දේ නෙමෙයි නම් කරපු දේ නම් අපි තවමත් කරන්නේ, that might not be the right thing that you do. So, based on the novel evidences, based on the novel findings, novel guidelines, you have to change your practices in order to improve the quality of your service. So, the important thing. So, you have to be always updated. So, update වෙන්නේ නැති nurses ළඟින් global employers වට වැඩක් වෙන්නේ නැහැ. ඒ වගේම next thing, communication. You have to be a very good communicator. And ඔයාලගේ නායකත්ව ලක්ෂණ. නර්ස් කෙනෙක් කියලා කියන්නේ පැත්තකට වෙලා patient බෙහෙත් ටික දීලා, patient ගේ injection එක දීලා, ඉන්න ටිකට් එකේ information එක ලියලා ඒක කරලා ඉන්න කෙනෙක් නෙමෙයි. That is a technical thing. But nursing is a profession. Of course, it is not something like that. So you have to master your leadership skill. Leadership skill එක, leadership කියන එක ඔයගොල්ලෝ හොඳටම master කරන්න ඕනේ. ඔයගොල්ලෝ කවදා හරි අදහසක් තියෙනවා නම් නර්ස් කෙනෙක් වෙලා ඉස්සරහට ගිහිල්ලා ලෝකෙ දියුණු රටක වැඩ කරන්න, That is one of the most important thing that you need to acquire. Then the next thing is cultural competence and adaptability. අපිට ලෝකයේ එක එක රටවල් වල එක එක කල්චර්ස් තියෙන්නේ. එතකොට අපි මේ හැම කල්චර් එකකටම අපිට ඇඩප්ට් වෙන්න පුළුවන් වෙන්න ඕනේ. work cultures වලට ඇඩප්ට් වෙන්න පුළුවන් adaptability එක තියෙන්න ඕනේ. එහෙම නැති වුණොත් we might not be able to survive in the field, especially in the developed countries. Your adaptability is most important thing. Then the digital literacy. ඔයාලට මේ digital literacy ඔයාලට digital media use කරන හැටි, එතනින් ගියාම මේ equipments use කරන හැටි, මේ system handle කරන හැටි ගැන හොඳ අවබෝධයක් තියෙන්න ඕනේ. නැත්තම් ඇත්තටම ඔයගොල්ලෝ මේ competition එකේදී පරාද වෙන්න පුළුවන්. හේතුව තමයි digital literacy නැතිකම. So ඔයාලා මොන ස්ටේජ් එකේ නර්සින් කරත් ඔයගොල්ලෝ කරන්න බලාපොරොත්තු වෙන හිටියත් මේ දේවල් ඔයගොල්ලෝ acquire කරන්න ඕනේ. ඉස්සරහට තියෙන ග්ලෝබල් ට්‍රෙන්ඩ් එකට ඇඩ්‍රස් කරන්න, ඒ වගේම මේකේ තියෙන ඩිමාන්ඩ් එකට ඇඩ්‍රස් කරන්න සහ ඕගොල්ලන්ගේ ඩිමාන්ඩ් එක ඉම්ප්‍රූව් කරගන්න ඕනේ. So, not only those skills, but also there are certain soft skills that matters, especially when you are hiring to another, let's say like another country, hired by another country. So critical thinking and decision making, as I told you, that is one of the most important soft skills that you have to handle, because you might get different cases, different scenarios and situations. Teamwork and interprofessional collaborations, ethical and compassionate practice, lifelong learning mindset, professional accountability. So let's talk about one by one in very simple terms, right? So critical thinking and decision making. Apita, critical thinking means you might have come across with different scenarios, different patients might be having different requirements. So you might not be able to practice like a robot. So you have to apply your critical thinking ability to, provide certain care as required to the patient. For example, some patient might be there, so the patient might be having fever. So you give paracetamol according to as prescribed by the doctor, right? And another patient might be there, that patient might be having fever, as well as this patient might be having a severe abdominal pain. So you cannot care both patients in the same way. Like, okay, now this patient is also having fever, I will be giving you paracetamol as prescribed by the doctor, and then I'll be leaving. So you can't do that, because you have to consider there are certain other things. So case by case, always nurses have to work out. So that part, or for that role, critical thinking comes into play when it comes to the provision of proper care to the patient. So then the teamwork and interprofessional collaboration, as I told you, you have to be a very nice team player. So you have to communicate with the other team members, you have to be very nice to them, you have to be very polite to them, professional, and you have to improve these communication skills, maybe your language skills, maybe your communication skills, and you have to be very ethical and compassionate. So as I told you, this is a very important soft skill I want to highlight. If you want to become a nurse, or if you are already a nurse, if you are not compassionate of what you are doing, you are not considered as a nurse. ඔයා නර්ස් කෙනෙක් වෙන්න ඕනේ නම් හරි දැනටත් ඔයා වෙලා තියෙනවා නම් ඔයා patient කෙනෙක්ට care කරන එක, එහෙම නැත්නම් ඔයා මේ profession එකේ වැඩ කරන එක ඔයාට compassionately ඔයා ඒක හදවතින්ම නෙමෙයි නම් කරන්නේ, ඇත්තටම ඔයාට මේ profession එකේ ඉස්සරහට යන්න බෑ. So that is another important thing. So lifelong learning mindset, because imagine that you are getting your degree and then you have become a registered nurse. That is not the place where you stopped everything, you stopped your education things and you are just trying to practice. It never happens, because nursing or healthcare profession is always updating. So lifelong learning mindset must be there, otherwise you might not be able to survive in this field. And the professional accountability, that is a very common thing. මේක බොහොම පොදු දෙයක්. හැම profession එකකටම තියෙනවා මේ වගවීම කියන එක. නැත්නම් අපිට වගකීමෙන් කටයුතු කිරීම කියන එක. So these are the main soft skills that matter, especially if you are trying to target yourself in the global nursing perspectives, right? So to achieve those things, some might be there in our audience, maybe they are nurses, some are who are willing to become a nurse in the future, or some are nursing students. I hope so. So when it comes to your academic progression, why it matters. Why it matters. So let's talk about academic progression in nursing nowadays and how we address to these challenges. So mainly what you need to consider is higher qualifications improve higher employability. So the higher your qualification, your employability, rates would be higher. So access to leadership, education, and research roles. So you higher, if you get higher qualification, you can become a leader in nursing, you can become an educator in nursing, or maybe you can become a researcher in nursing, which we identified certain knowledge gaps and we fill the gaps, so we would be scientists as well. So global recognition and mobility, that is what I told you, like, when you are improving your qualifications, your recognition will be parallelly improved, and better career stability and income potential. So you improve your qualifications, you improve your income potentials. එතකොට academic progression එක වැදගත් වෙන්නේ පුළුවන් තරම් academically වගේ field එකේ ඉස්සරහට යනකොට. දැන් ගොඩක් වෙලාවට ලංකාවේ තිබුණ trend එකක්, once you get a diploma, you can become a registered nurse. Registered nurse කෙනෙක් වෙන්න පුළුවන්. But trend එකක් තිබුණා එතනින් එහාට මේක progress වෙන්නේ කරන්නේ නැති. But nowadays ලංකාවේ දැන් ගොඩාක් nurses ලා උත්සාහ කරනවා ඒගොල්ලන්ගේ මේ academic progression එකට යන්න. diploma එකෙන් degree එකට යන්න. degree එකෙන් postgraduate degree එකට යන්න. postgraduate එකෙන් නේද? එක්කෝ ආචාර්ය උපාධියකට යන්න, නැත්නම් we call it PhD, or maybe any other higher research degree, something like that. So a improvement එක ගත්තොත් ඔයගොල්ලන්ට ලැබෙන දේවල් තමයි ඔයාලගේ global recognition එක as a nursing professional කෙනෙක් විදිහට ඒක වැඩි වෙනවා. ඒ වගේම ඔයාගේ career stability එක වැඩි වෙනවා. එහෙම නැත්නම් ඔයාගේ අපි කියන්නේ අර ඔයාගේ වෘත්තියට තියෙන වටිනාකම වැඩි වෙනවා. So ඒක නිසා you will get more and more income potentials. එහෙම නැත්නම් ඔයාට මීට වඩා හොඳ offers වලට ඔයගොල්ලන්ගේ ලෝකෙ ගොඩක් දියුණු රටවල් වලට ඔයගොල්ලන්ට යන්න ප්‍රවිෂ්ඨ වෙන්න අවස්ථාව තියෙනවා. So higher educational qualification in nursing is one of the most important thing that you need to identify and highlight here. So as I told you, just to show you these things. So probably in Sri Lanka, this is the particular trend here we can see nowadays. So mainly most of the nursing professionals working in Sri Lanka may be starting their career as diploma in nursing qualification, and then they might be probably topping up their degree. So they will be getting a BSc nursing or a degree in nursing. So some of the nursing staff who completed their degree, then they might be probably interested to go to a postgraduate qualification, maybe a master's, maybe MPhil, something like that. So after that, you might be probably moving forward to serve further specialties in nursing. Now, in Sri Lanka, even though we have specialties, we don't have a proper recognition. But when it comes to developed countries, of course, yeah, there are certain nursing specialties, very well recognized nursing specialties, as we have mentioned above. So research-based high-end masters and PhD degrees might be available then after that, and you can continuously improve your professional development can be done afterwards. So even after PhDs, we can go up on the ladder. So most of the countries, like in US and Canada, countries like Canada, we have nursing consultants. So there are different very highly paid opportunities and jobs available in the field of nursing, so that you can improve your academic pathways and you can climb up the ladder. So no matter where you start, maybe in a degree, maybe with a degree, maybe with a diploma, you still have the pathway available for you to master yourself up and improve yourself up and move forward. So as I told you, especially in 2026 upwards, future nurses' profile should contain following things. So if you do not have these things, you might not be able to improve yourself, right? Or you might not be able to survive yourself. So especially a clinically competent nurse, you have to be a clinically competent person, academically progressive person, digitally confident person, and globally mobile. That means you should be able to, uh, mobilize globally here and there. So ethically grounded person. So this would be the future nurses profile in 2026 and upwards. So um, based on that, these are the messages to future nurses and students. Yeah, I would just want to tell you, nursing is a respected global profession. So it's not something just that you are doing, just caring the patient, giving drugs, or giving injections or something like that, putting in IV lines or something like that. It is a very respected global profession, very well recognized global profession, and highly paid profession all around the globe. So opportunities extend far beyond hospitals. It is not something that you are working in rosters, working in shifts in a hospital. It is a lot more. So you have a lot to explore in the field of nursing. So education is the key to unlocking global careers. As I told you, if you are stuck or stagnated in somewhere in the field of nursing, so of course, education is the most important thing to unlock the doors for global nursing careers. And your journey today shapes global healthcare tomorrow. And well, so in case if you are interested to become a nurse, or if you are interested to improve yourself to a degree level, in case if you are interested to master your pathways in the field of nursing, or to go up in the ladder in the nursing journey, why you need to choose ESU is something that I, of course, need to talk about it, because uh, we have certain things to deal with it. So mainly, ESU is we consider it as internationally aligned nursing programs. So we actually conduct internationally aligned nursing programs offered by London Metropolitan University here in ESU, or ESOFT University. So focus on academic progression and global employability. That is why I told you, like, we need to address to the requirement, not to do something conventional just to get a qualification. So we wanted to highlight that. And experienced academic and clinical faculty. So we have a very experienced experts in the field of nursing to support you out, and also clear pathways to global nursing opportunities, as we have discussed in previous slides. So these are the things that I just wanted to discuss with you. So thank you so much for being with me and paying your attention. And I hope you took something from this particular discussion we had. So in case if you have any questions, I would like to answer your questions. So it is open to discussion. Over to you, Shari.
Thank you very much, Mr. Madhuranga, for the informative and insightful presentation. And we truly appreciate you sharing your knowledge and experiences with us. So, dear participants, if you have any question, please feel free to ask them now. You may either raise your questions verbally, or you can just type them into the chat box. So, Mr. Madhuranga, we have already received a few questions in the chat box. So, I will start with the first one and proceed with the other questions. So, the very first question is,
Yes.
what requirements we need for nursing top-up degree?
Well, as I told you, most of the Sri Lankan nursing staff, like registered nursing staff, is on the diploma program, which is NVQ level 6, or maybe the diploma that you acquire from nursing training schools from the government sector. So for a nursing top-up degree, basically you need very few things, especially your language requirements. So you have to have a minimum of C pass for your O-level English language, and then you have to have 3 years nursing diploma, which is it could be NVQ level 6, or maybe the NTS or the nursing training school offered diploma program, which is 3 years diploma program. And the other thing is you have to engage in the nursing profession, or working as a nurse in a private or a government hospital. So those people are eligible to improve and advance themselves with a degree. So you can eligible to get into a top-up degree. So this top-up degree would be another 1 year program. So yeah, so these are the most uh, important and basic requirements that you need to fulfill.
Okay, Mr. Madhuranga, our next question is there any organization who provide lectures and examinations for ACLS certification?
I think ACLS, that means Advanced Life
ACLS,
Support
yes.
Certificate. Yeah. So is there any organization? Yes. This particular training is conducted by College of Anesthesiologists, which is, if you can Google it, you can find the information. So they are providing this particular certification. It's a license. So you have to renew this license every 1 year or 2 years, as far as I can remember. So yes, that is the particular organization who give this particular license. We call it Advanced Life Supports, and the BLS and ALS trainings can be conducted in any institutes if they are having resources, but the license, of course, from the College of Anesthesiologists. So there are
Okay,
plenty of
Mr.
other
Madhuranga.
questions. Yeah.
Yeah. So the next question is actually how to join the course. Please explain in Sinhala.
Right. Okay. මම එක කියන්නම්. අපේ කෝස් එකට ජොයින් වෙන්න පුළුවන් ඔයා නර්ස් කෙනෙක් නම් මේ වෙනකොට රෙජිස්ටර්ඩ් නර්ස් කෙනෙක් විදිහට කොහේ හරි වැඩ කරන කෙනෙක් නම් ඔයගොල්ලන්ට ජොයින් වෙන්න පුළුවන්. අපි මේ වෙනකොට කොළඹ සහ කැන්ඩි අපේ Esoft University branches දෙකේම අපි මේ program එක කරනවා. We'll be starting on coming February onwards. එතකොට අපි February ඉඳලා තමයි පටන් ගන්නෙ. මේකට ජොයින් වෙන්න මේ තියෙන්නේ අර මම කිව්වා වගේම ඔයා මේ වෙනකොට නර්ස් කෙනෙක් නම් ඔයා නර්සින් ෆීල්ඩ් එකේ වැඩ කරලා තියෙනවා නම් හරි ෆ්‍රෙෂර් කෙනෙක් වුණත් එහෙම නැත්නම් අලුතෙන්ම ඔයා නර්සින් ෆීල්ඩ් එකට ජොයින් වුණත් with the diploma 3 years diploma ඔයාට පුළුවන් අපිත් එක්ක ජොයින් වෙන්න top up degree එකට so ඔයාට රෙජිස්ටර් වෙන්න පුළුවන් අර මම කියපු මුලින් කතා කරපු requirements ටික තියෙනවා නේ. ඒ කියන්නේ අපිට language එක ඕනේ O level වල English C pass එක ඊළඟට ඔයා මේ වෙනකොට කොයි හරි ප්‍රයිවට් හොස්පිටල් එක හරි ගවර්න්මන්ට් හොස්පිටල් එක හරි නර්ස් කෙනෙක් විදිහට වැඩ කරන බව අපිට ප්‍රූෆ් තියෙන්න ඕන. ඊට අමතරව ඔයාට රෙජිස්ට්‍රේෂන් එක තියෙනවා නම් හරි පෙන්ඩින් රෙජිස්ට්‍රේෂන් එක තියෙනවා නම් හරි ඔයාට එලිජිබල් ඔයාට පුළුවන් පිට එක ජොයින් වෙලා ප්‍රෝග්‍රෑම් එක කරලා টপ අප් එක කම්ප්ලීට් කරනවා. So registration එක සමහරුන්ට ඇති ශ්‍රී ලංකා නර්සින් කවුන්සිල් එකෙන් සමහරුන්ට ඇති ශ්‍රී ලංකා මෙඩිකල් කවුන්සිල් එකෙන් තවත් සමහරුන්ට ඇති PHSRC එහෙම නැත්නම් private health services regulatory council එකෙන් ගොඩක් වෙලාට private sector එකේ private hospitals වල වැඩ කරන කට්ටියට හම්බෙන්නේ මේ PHSRC registration එක තමයි. එතකොට ඒ ඕනම එකක් eligible ඔයගොල්ලන්ට ඒ registration එක තියෙනවා නම් ඔයගොල්ලෝ pending registration එකේ ඉන්නවා නම් hospital එකෙන් reputed hospital එකක work කරනවා නම් ඒක හොඳටම ප්‍රමාණවත් ඔයාලට අපිත් එක්ක join වෙන්න.
So, Mr. Madhuranga, we have two questions related to higher studies just after bachelor's.
Right. There are a lot of opportunities just after the bachelor's. It depends. Now, once you complete your bachelor's in general nursing, you can identify what is the particular specialized area that you are interested of. For example, I myself was interested in the psychiatric and mental health, so that I wanted to improve myself in that particular area. So you can, there are master's programs available all around the world. Most of the, the top rated universities offer those things, and you can apply for scholarships and also for PhDs and other research related master's higher degrees. So you can apply for scholarships, you can write for scholarships. Maybe, there are certain institutions, state universities as well as non-state universities provide this master's qualification. And if you are planning to go abroad, of course, there are plenty of opportunities available, especially if you are having a basic degree with a, let's say like first class or a second upper, then you might be able to get certain scholarship opportunities with foreign universities for PhDs and MPhils. MPhil degrees වලට යන්න පුළුවන්. It is, usually we cannot find much scholarships for master's degrees, but තියෙනවා rare. A qualification achieve කරලා තියෙනවා නම් approach කරලා තියෙනවා නම් of course there are a lot of opportunities that you can migrate yourself, migrate and do those degrees, particular postgraduate qualification, fulfill all these postgraduate qualifications abroad. Yes. So mainly it depends on your degree. ඔයාගේ degree එකේ level එක, ඔයාගේ degree එකේ class එක, ඔයාගේ degree එකේ අපි කියන්නේ ඒකේ characteristics බැලුවහම තමයි අපිට identify කරගන්න පුළුවන් කොහොමද ඔයාගේ path එක යන්නේ කියලා. So if you can come and let us know about this, we can guide you more. Yes. So that is the basic thing. What is your requirements?
And the next, it's all about the qualification we just required for the masters and the UGC recognition.
So yeah, summary regarding doing masters once after finishing BSS. So the field of mastering or anything. Sorry. Can you please repeat the
Yeah. So
yeah.
the
So our program, yes, of course. ESOFT University is a UGC recognized university, and also London Metropolitan University is a university which is recognized by the UGC. And if you can consider about the Commonwealth list of universities which was published by UGC, you can find London Metropolitan University, which is available and recognized by the University Grant Commission in Sri Lanka. Yes, it's a recognized university. So this degree program is offered by a recognized UGC recognized university from UK. Yes.
Okay, so the next question is there any diploma course available at ESU?
Currently, for nursing, no, we do not have a diploma course available, but we are in process and in planning of initiating the diploma program as well, but in future, in near future. So while we are doing it, we'll let you know and we'll keep you update about this. Thank you so much. Anything else, please?
And yeah, Mr. Madhuranga, there's one question. How to apply for private registrations and what are the qualifications for College of Anesthesiologist?
For the College of Anesthesiologists, there is no actually proper qualifications required. So if you are a nurse or if you are anyone who is in the healthcare sector with a proper certified recognized qualification, you can go and do this particular program. So it's a small short course. As far as I know, it is 72 hours short course. So then you can get registered and conduct that particular thing with clinical. So they are giving these hands-on skills and all this training provided by them, mainly related to ALS and BLS both. And then I'm talking about these particular terms. I think this particular person who is asking this question might be having a proper idea about what it is. So of course, so that College of Anesthesiologists doing this program, so it doesn't matter whether you are a doctor or a nurse or any other member of the healthcare setup and emergency, as we know, like EMTs, like emergency medical technicians. So they provide this course, so anybody who is in this field of healthcare is eligible to do this program. Yes.
Yes, that's all, Madhuranga.
Right. So
All right.
right.
Yes.
In case if you need any further information regarding the program, so you can contact our ESU team, and I hope you can provide your details, so our team will contact you in due course as well. So yes, thank you so much for your time and your participation for this session, and I hope that you have taken something new and new hopes, new goals set for yourself and for your future as well. So thank you so much for everyone for participating for this special webinar. And we'll meet again with a new topic and with new discussion about the field of nursing in future. So thank you so much and good night.
Yes, I would like to thank Mr. Madhuranga once again for sharing his valuable insight with us today. So, on behalf of Ace of Tunic Colombo and the Faculty of Life Sciences, I would like to thank all of you for joining today's webinar. So, we hope this session has been informative and beneficial to your academic and professional journey. So, thank you very much and have a wonderful day ahead.